Hello, welcome to another episode of the Health Series, Your Health, Your Choice. My signature remains Dr. Joe, a medical doctor and a health promoter. Today we'll be talking about diabetes. In the part 1 of this video, we'll be looking at what diabetes mellitus is all about, why should people know about it, the types of diabetes, the causes of diabetes, the risk factors and the symptoms and its complications. Before we continue, I just want you to know that the purpose of this video is not to give you medical advice. Rather, it is to give you information. And my hope here is to present information to you or just presenting a new light in a way that is relatable. And with this information, if you are able to understand it, then you can make choices that hopefully will make you to be more healthy and live longer as well as have a happy life. So let's get started. Diabetes is a condition in which sugar levels in your blood are high. So when you eat, some of the food are broken down into, the food that is broken down into sugar, also called glucose. So sugar travels in your blood to all your body's cells. Now, many people ask themselves this question: why is my blood glucose level high? Why does this happen? Stay tuned to find out the answer. The process of digestion includes breaking down the food you eat into various different nutrient sources. When you eat carbohydrates, for example bread, rice, pasta, your body breaks this down into sugar, that is glucose. When glucose is in your bloodstream, it needs a help, that's a key, to get into its final destination where it is used, which is inside your body's cells, that is cells that make up your body's tissue and organs. This help or key is called insulin. Insulin is a hormone made by your pancreas, an organ located behind your stomach. Your pancreas releases insulin into your bloodstream. Insulin acts as the key that unlocks the cell wall door, which allows glucose to enter your body cells. Glucose provides the fuel of energy tissues and organs need to properly function. Special cells in the pancreas cause beta cells make the insulin. When blood sugar rises above certain points, the body signals the pancreas to release insulin. This insulin helps the cells use sugar. Cell walls have little lock called receptors. So insulin fits into those locks like a key. When insulin opens the lock, sugar is allowed to enter the cells. When the body is not able to make enough insulin, blood sugar is locked out of the cells. Sometimes the lock changes in shape. Then the insulin can no longer fit in there. Either ways, blood sugar is locked out of the cells. It stays in the bloodstream and can become too high, causing hyperglycemia, which can lead to symptoms of diabetes. When cells cannot have glucose, they no longer have the fuel they need. The pancreas tries to make up for this by trying to work harder. At first, the pancreas keeps up by making more and more insulin. In time, the pancreas is unable to continue doing this, which is when the symptoms of diabetes may appear. If you have diabetes, it is either your pancreas does not make any insulin or enough insulin, or your pancreas makes insulin but your body cells don't respond to it and it can't use it as it normally should actually. So if glucose can't get into your body's cells, it stays in your bloodstream and your blood glucose level rises, which leads to conditions called diabetes. So what are the different types of diabetes? The types of diabetes are, we have type 1 diabetes. This type is an autoimmune disease, meaning your body attacks itself. In this case, the insulin producing cells in your pancreas are destroyed completely. Up to 10% of people who have diabetes have type 1 diabetes. It's usually diagnosed in children and young adults, but can develop at any age actually. People with type 1 diabetes need to take insulin every day because their body cannot produce insulin at all. This is why it is also called insulin-dependent diabetes. Then we have type 2 diabetes. With this type, your body either does not make enough insulin or your body cells don't respond normally to the insulin that is produced by the body. This is the most common type of diabetes because up to 95% of people with diabetes have type 2. It usually occurs in middle age and older people. Then we also have gestational diabetes. This type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you are at higher risk of developing type 2 diabetes later in life. So, how common is diabetes? About 422 million people worldwide have diabetes, the majority living in the low and middle income countries, and 1.5 million deaths are directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past few decades. So this question, who gets diabetes? What are the risk factors? Factors that increase your risk differ depending on the type of diabetes you ultimately develop. Risk factors for type 1 diabetes include having a family history, parent or siblings of type 1 diabetes, having injury to the pancreas such as by infection, tumor, surgery, or by accident, presence of autoantibodies that mistakenly attack your own body's tissue or organs, then physical stress such as surgery or illnesses, exposure to illnesses caused by viruses, also risk factors for type 1. Now, risk factors for pre-diabetes and type 2 diabetes include family history, that means parent or siblings of pre-diabetes or type 2 diabetes, being Black, Hispanic, Native American, Asian American, race or Pacific, people living in the Pacific regions, having overweight or being obese is also a risk factor for type 2. Having high blood pressure is a risk factor. Being physically inactive is also a risk factor for type 2. Being age 45 or older, having a gestational diabetes or giving birth to a baby weighing more than 9 pounds is also a risk. Then being a smoker is also a risk attached to type 2 diabetes. So what are the risk factors for gestational diabetes? We have family history of pre-diabetes or type 2 diabetes, being African, American, Hispanic, Native American or Asian American, being overweight, being obese before your pregnancy, being over 25 years of age. These are the risk factors associated with gestational diabetes. So, what are the common signs and symptoms of diabetes? Number one, urinating often more than usual. When there's too much sugar in the blood, your kidneys try and filter it out. They dump it into your urine, creating more pee. In more advanced stages of the disease, damaged nerves around the bladder may cause some people to feel the urge to pee frequently, even if little or nothing actually comes out. You also have a higher risk of having a urinary tract infection, known as UTI. Being thirsty more often than usual. When your blood has too much sugar in it, your body pulls water from surrounding tissue to try to dilute it. That leaves you dehydrated and thirsty. Some diabetics feel like no matter how much they drink, they can't actually quench their thirst. Number three, being hungry more often than usual. If you are hungry all the time, even after a good meal, it could be a sign that your muscles and other tissue aren't getting the energy they need, that is glucose. They need from the food you are eating because it's hung up in your bloodstream. So your muscles tell your brain that they are actually starving, even though you have ate plenty, making you hungry again and continuing the cycle. Unusual weight loss. Losing weight without changing your diet could be a sign of type 1 diabetes. If your body can't get the glucose it needs from food, it will start to break down its own fats, muscle, and other tissues for fuel, leading to weight loss. Then we also have fatigue as a symptom, or being tired more often than usual. You may feel exhausted and weak because your brain, muscles, and other body systems are not getting the energy they need to work properly. If you are dehydrated, that can make you tired too. Then another symptom is having blurring vision. High blood sugar can lead to a leaking of fluids into your eyes, causing the lens to swell. That leads to trouble focusing. Then they can present with increased infection. Type 2 diabetes makes it harder for your immune system to fight off infection, including yeast infection or urinary tract infection. So it might also take longer for cuts to heal because extra glucose prevents white blood cells from doing their repair work. Then they may have wounds that will not heal. They may have numbness or tingling of the hands or feet. Also, these are the symptoms. So what are the complications of diabetes? If your blood glucose level remains high over a long period of time, your body's tissue and organs can be seriously damaged. So some complications can be life-threatening over time. High blood sugar level can seriously damage part of your body, including your feet and your eyes. These are called diabetic complications. But you can take action to prevent or delay many of these side effects of diabetes. So what are the major complications of diabetes? You might hear your doctor or healthcare team talk about two types of diabetes complication. Serious one that builds up over time called chronic complication, and the ones that can happen at any time called acute complication. So in this video, we'll be talking more of the chronic complications. These are long-term problems that can develop gradually and can lead to serious damage if they go unchecked and untreated. Eyes problem, that is retinopathy. Some people with diabetes develop an eye disease called diabetic retinopathy, which can affect their eyesight. If retinopathy is picked up, usually from an eye screening test, you might need to treat that. It can be treated and sight loss may be prevented. Then foot problem. Diabetic foot problems are serious and also can lead to amputation. Nerve damage can affect the feeling in your feet, and raised blood sugar can damage the circulation, making it slower for sores and cuts to heal. That is why it is important to tell your doctor if you notice any change in how your feet look or feel. Amputation. Diabetes-related damage to blood vessels and nerves, especially in the feet, can lead to serious hard-to-treat infections. So amputation can be necessary to stop the spread of infection. Heart attack and stroke. When you have diabetes, high blood sugar for a period of time can damage your blood vessels. This can sometimes lead to heart attack and stroke. Kidneys problem, nephropathy. Diabetes can cause damage to your kidneys over a long period of time, making it harder to clear extra fluid and waste from your body. This is caused by high blood sugar level and high blood pressure. It is known as diabetic nephropathy, because there is damage to the kidney. Some people with diabetes may develop nerve damage caused by complication of high blood sugar levels. This can make it harder for the nerves to carry message between the brain and every part of our body, so it can affect how we see, we hear, we feel, and we move. It can also come down with gum disease. Also, too much sugar in your blood can lead to more sugar in your saliva. This means bacteria which produces acid, which attack your tooth enamel and damage your gum as well. Sexual problem in men. Erectile dysfunction. The amount of blood flowing to your sexual organs can be restricted, which may cause you to have difficulty getting aroused. It may lead to erectile dysfunction, sometimes called impotence. Complication of gestational diabetes. In the mother, you have preeclampsia, that has high blood pressure, excess protein, urine, leg and feet swelling, risk of gestational diabetes during future pregnancies, and risk of diabetes later in life. The newborn, you have higher than normal birth weight, low blood sugar, that hypoglycemia, higher risk of developing type 2 diabetes over time, and death shortly after birth. How is diabetes diagnosed? Getting diagnosed with diabetes involves blood tests and potentially additional testing to figure out which type you have. So correct diagnosis is important since treatment differs depending on the type. Blood test for diabetes. The first step in getting a diabetes diagnosis is blood test. We have the HbA1c or glycated hemoglobin test. This is common test measure what percentage of your red blood cells have been coated with glucose over the past 2 to 3 months. The higher your blood sugar, the higher your score. An HbA1c result below 5.7 is considered normal. 5.7 to 6.4 is pre-diabetes. 6.5 or above suggests diabetes. Then we have fasting blood sugar test. Blood will be drawn first thing in the morning before you eat or drink anything other than water. As a result under 100 mg per deciliter is normal. 100 to 125 mg per dl is pre-diabetes. 126 mg per dl or above indicate diabetes. Then we have glucose tolerance test. After getting your blood drawn on an empty stomach, you will drink a glucose drink, then have blood drawn again after 1 to 2 hours. If your blood sugar is under 140 mg per dl 2 hours after taking the sugar drink, that is normal. Between 140 to 199 is pre-diabetes. Then greater than 200 mg per dl is known as diabetes. Then we have a random blood sugar test. Random blood sugar test. Blood is drawn at any time of the day, whether you have eaten recently or not. The results greater than 200 mg per dl with symptoms of diabetes means you may have diabetes actually. So, who should be tested for diabetes? If you have symptoms or risk factors for diabetes, you should get tested actually. So, the earlier diabetes is found, the earlier management can begin and complication can be lessened or prevented. If a blood test determines you have pre-diabetes, you and your healthcare professional can work together to make lifestyle changes, that is, weight loss, exercise, healthy diet to prevent or delay developing type 2 diabetes. Now we have come to the end of part 1 of this episode on diabetes mellitus. Please stay tuned as you watch out for the part 2, where we will be taking a look at how this condition is treated, how to prevent it, and I will be sharing with you too what and how to eat if you have been diagnosed with diabetes, as well as other tips to prevent further complications. Thank you for joining me today. Don't forget to like, to subscribe, and to share.